So first, we are asking Dr. Eby to come up, who is the chair of our Community Advisory Council, and he has been the chair for 3 years and also on the board of directors. So.
Well, I like this place for several reasons. One is I didn't have to sit up here at a table for a whole hour and a half and have you look at me and all my weird appearances and so forth. So you just had me for a few minutes. It was the effort of the people that plan these programs to make them more interesting, and so they want us to make our presentations exciting. I don't know. It's a bit of a task. First of all, because guess what I'm supposed to talk about? What are the 3 most important responsibilities of the CAC? Now, isn't that exciting? There are only 3, and they're mandated by the state, and they're in our charter, and so I feel compelled to read them. The responsibilities of the CAC include, but are not limited to, identifying and advocating for preventative care practices to be utilized by the CAC. Now, like a good preacher, I have a text and I'll expand on it. This is really a very important thing, and it's very integral to our community health improvement plan, where in fact, it is one of the main goals of the transformational approach to medical care, and that is to have preventative care practices and not just therapeutic care practices. And so through our community health improvement plan, and I'll talk a little bit more about that later, how that came about, we are doing that. We have done it, we continue to do it through various things that we do. And in doing that, B, the second thing is overseeing a community health assessment and adopting a community health improvement plan to serve as a strategic population health and healthcare system service plan for the community served by the IHN-CCO. When I had my very first meeting with Kelly about 3 years ago, she gave me this paper. She said, "That's what you're supposed to do," and I thought, okay. And with the help of Rebecca Fowler, who is back there, our coordinator, we did it. And now we are in the process of looking at those and trying to figure out how we make them more meaningful. And the last thing is publishing a report on the progress of the Community Health Improvement Plan. That's C. That's pretty boring. So, what is the most exciting thing that the CAC is involved in today? There aren't exactly a lot of things to choose from, as the very nature of our responsibilities mean that we spend most of our time and energies on the responsibilities mentioned above. It would not be unfair to suggest that the most exciting thing that the CAC is involved in is to be part of transforming healthcare in our Tri-County area. A multitude of agencies and persons are involved in this. Each plays a unique role. As involves the Advisory Council, beginning at the county committees through the work groups and frequent other meetings, ideas are generated that are tested and filtered through the assessment and improvement plan and filtered and assessment and often surface for the exciting pilot projects, which you just heard about. Working together and encouraging each other, strength is a journey and cooperative generation of ideas and projects that is something we could all wish for, especially something as meaningful and beneficial as the projects coordinated by the IHN-CCO. So each county has a committee that meets once or twice a month. And they were the energy people, they were the resource people, and with Rebecca's help, did the work of doing, first of all, the community health assessment plan to determine what are the needs of our Tri-County area, and then putting together an improvement plan to try and carry these out. And I don't know if you mentioned this or not, I wasn't paying attention, but every pilot has to pass muster with our improvement plan. And most of them, there are several things that they fit into. Sometimes it's just one if it's a particular thing, but they all must pass muster with our improvement plan. And I don't know how many things really came out of it that the people that projected pilots got their ideas from, whether they got it from our chip or not. I'm not sure about that. I'd like to think that they did, but I can't prove that. So it's, as I said, I think the most exciting thing is to be involved in transforming healthcare in a Tri-County area. And if you are willing to spend hours a month, sometimes hours a week, with a lot of really nice people that are all interested in in this sort of thing at the county level, you might get on the council, and you might even get sometime elected chair of the council, but not for 3 years, because today we just elected a new president, new chair at our last CAC meeting, who is installed today by the board, and it is none other than your own Ellen Franklin. Would you? So, after my boring chairmanship, although it wasn't always boring for me, Ellen, I'm sure, will bring excitement and new ideas, and I'm so happy to turn things over to her, but not this evening yet. Any questions? Thank you.